Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Endocrine causes of endocrine features of chronic renal failure. Endocrine features of chronic renal failure are there can be secondary. The endocrine features are secondary to hyperparathyroidism, and these endocrine features are mainly due to decreased phosphate excretion. Due to decreased phosphate excretion by the kidney, these endocrine features are present. There is presence of glucose intolerance can be seen in the patients, and these glucose intolerance mainly occurs in the patients due to insulin resistance, and the patients will develop hypoglycemia also. Why? Because of impaired insulin metabolism. One, there is uh, glucose tolerance. Because of glucose tolerance, there is insulin resistance will be seen, and because of hypoglycemia will also develop, mainly because of impaired insulin metabolism will result in hypoglycemia. Then there is amenorrhea is seen in the patients, and then there is impaired testicular there is also impaired testicular function is seen in the patient. This impaired testicular function is mainly because of low testosterone levels will result in increased testicular function. Impaired testicular function is due to low testosterone levels. There is impotence is seen in the patients, and the patients will also suffer from erectile dysfunction are also seen in the patients.
thank you and thank you for watching.